Hi everyone, I'm Jara Marcos and I'm a student from the College of Arts and Sciences. For my STAR project, I examined the role of weight self-stigma in social comparison and excessive eating under my mentors Dr. Evan Foreman and Dr. Adrian Horacio, as well as my co-mentors Hannah McCausland and Lauren Taylor. Eating, the most simple and fundamental human mechanism, has underlying complexities, especially in a society influenced by media and interpersonal interactions. This can cause individuals to engage in social comparison and heightened weight self-stigma, which fosters individuals to partake in excessive eating as a coping mechanism. Those with overweight and obesity commonly report engaging in excessive eating, which can maintain overweight and obesity and is linked to several negative health outcomes, including cardiovascular disease and diabetes. Excessive eating is also a component focused in behavioral weight loss programs. Previous studies suggest that when individuals with overweight/obesity watch stigmatizing content, they are more likely to eat more calories than individuals with normal weight, and they are also more susceptible to hunger when faced with unfavorable social comparisons. However, there is little research on the differing levels of weight self-stigma and social comparison in excessive eating and determination. Thus, we hypothesize that individuals who engage in excessive eating are more likely to have higher levels of weight self-stigma and upward social comparison and lower levels of downward social comparison. This study was conducted through a secondary data analysis on Project FitLink, an ongoing behavioral weight loss clinical trial that analyzes whether or not data sharing is beneficial in behavioral weight loss programs. There were 318 participants whose BMIs were between 27 to 50 kilograms per meter squared, and amongst those participants, 189 endorsed excessive eating and 129 did not. 17.3% of the participants were male and 82.7% were female. 80.8% of the participants were white and 19.2% were people of color. The average age of the participants was 53.39. Data was collected at baseline before treatment was administered. Participants were asked to complete surveys, such as the Weight Self-Stigma Questionnaire and the INCOM Upward and Downward Social Comparison Scale. The surveys were based on Likert scales, in which individuals rated statements from 1 being I strongly disagree to 5 being I strongly agree. The Weight Self-Stigma Questionnaire included statements like, I'll always go back to being overweight. The INCOM Upward Social Comparison Scale included statements like, when it comes to my personal life, I sometimes compare myself with others who have it better than I do. And the INCOM Downward Social Comparison Scale included statements like, when it comes to my personal life, I sometimes compare myself with others who have it worse than I do. Excessive eating was self-reported and participants were asked, in the past 3 months, have you ever eaten in one sitting what felt like an excessive amount of food? Once the data was collected, we performed a one-sided independent sample t-test on SPSS. Based on the results, participants were engaged in excessive eating on average, had higher weight self-stigma, upward social comparison, and downward social comparison compared to participants who did not engage in excessive eating. Besides the great difference in mean average, the one-sided independent sample t-test also proved that the difference between individuals with excessive eating was statistically significant compared to individuals without excessive eating in relation to these variables. Thus, statistical significance indicates that the individuals with excessive eating have higher levels of weight self-stigma, upward social comparison, and downward social comparison. Due to these findings, weight self-stigma, upward social comparison, and downward social comparison may serve as risk factors for excessive eating and can be components to focus on in behavioral weight loss programs. Our hypothesis was partially correct, in which we incorrectly believed that individuals with excessive eating would have lower downward social comparison. Interestingly, they had higher levels of downward social comparison, which may occur as a coping mechanism or justification to engage in excessive eating. For future works, it will be interesting to observe how different racial and ethnic backgrounds can possibly exacerbate weight self-stigma and social comparison in relation to excessive eating determination. Another direction is to analyze loss of control eating in conjunction with excessive eating in order to have a better understanding of how these factors can impact eating disorder pathology. Finally, it would be interesting to test out how behavioral weight loss treatments can be more effective if it focuses on the possible risk factors of weight self-stigma, upward social comparison, and downward social comparison, ultimately leading towards a step further in creating effective behavioral weight loss programs. Before I conclude my video, I would like to acknowledge Hannah McCausland and Lauren Taylor for their help and guidance throughout the project. Also, Dr. Megan Buttrin, as she is the principal investigator for Project FitLink, and for allowing me to use her data. Finally, Devin Riddle for his generous support. Thank you.